Hello, welcome to Metier International Academy, one of leading academy in training nurses in the nursing competitive exam as well as IELTS and NCLEX and OET training. And welcome back to Magic Bell session. In Magic Bell session, as you all know, that we are discussing very important topic based upon the demands of the students. And also we are discussing the MCQs, which is related to that particular topic. And also we are discussing the additional golden points, which is very essential for your upcoming examination. And hope everyone would have done the prelims NORCET 8 exams well. And now it is a time for preparing your mains, RRB, and also for your upcoming NORCET 9 examination. So watch the videos till the end. Definitely all the videos, whatever you are posting, definitely it is going to be so much useful for you for your upcoming examination. So today's topic is very, very important topic. So many students asked about this topic. They are having so many confusions, doubts in this topic. So that's why we have selected this topic. So the topic, before discussing about the topic, as usual, thought of the day. The thought of the day for today is: slow progress is better than no progress. Stay positive and don't give up. And don't give up. Okay, so this is the thought. With this thought, let's start the topic. The topic what we are going to discuss is fetal circulation. Very important topic. Okay, and also the vital points related to that particular fetal circulation we are going to discuss. So if you like the video, please like it, share it, and subscribe our channel. Let's begin the session. What is fetal circulation? The circulation which is present inside the fetus when the fetus it is in the mother's womb. Okay, see guys, totally two differences there in the fetal circulation and general circulation. So if the baby it is in the mother's womb, that time we call it as fetus, and in that fetus two thing is totally inactive. Again, I'm repeating, two thing is totally inactive. The first one is lungs and second one is liver. Okay, so in fetal circulation, there is a non-functional fetal lung and partially functional liver is present. So there is so many changes which is present in the systemic circulation of the fetus. Okay, so that is called as what? Fetal circulation. Okay, so once again I'm repeating, non-functional lungs and non-functional or partially functional liver is present in the fetus. So many bypasses is happening in the circulatory system. That is called as what? Fetal circulation. In detail we will be discussing mainly three things we are going to discuss: how the oxygen is transported, and how the deoxygenated blood is formed, and how the ductus venosus, ductus arteriosus is foramen ovale. All these things are playing a vital role. Okay, so these things we are going to discuss mainly in the fetal circulation. Okay, fine. So with the flow chart, let's discuss in detail. First, you should know about placenta. Placenta is from the maternal side, and the placenta is the one which originated to the umbilical chamber. From the placenta, the umbilical chamber arises. Inside the umbilical chamber, one vein, two arteries are present. One vein, two arteries are present. In short, you can keep as a mnemonic AVA. AVA means two arteries and one vein, and vein always carries oxygenated blood in the fetus, that is in the umbilical vein. Umbilical vein, underline the word, umbilical vein always carries the oxygenated blood, and arteries, umbilical arteries carries the deoxygenated blood. Umbilical vein carries oxygenated blood, umbilical vein carries deoxygenated blood. Okay, so from the placenta, umbilical chamber arises, it enters inside the liver. Inside the liver of the fetus, it connects with the inferior vena cava. The umbilical vein, underline the word, umbilical vein is connected with the inferior vena cava. Okay, so umbilical vein carries oxygenated blood and inferior vena cava carries deoxygenated blood. Both are connected. That connecting place is called as what? Ductus venosus. You can see very clearly here. Okay, so this is the umbilical vein and this is the inferior vena cava. Both are getting connected. Inferior vena cava carries deoxygenated blood and umbilical vein carries oxygenated blood. Both are getting connected here. In this point, it is called as what? Ductus venosus. Okay, fine. So now there is a mixing of the blood. Oxygenated blood and deoxygenated blood both are mixed together, and through the umbilical vein, through the inferior vena cava. What is this? Inferior vena cava. Through the inferior vena cava, the oxygenated, deoxygenated, mixed blood, it is going to enter inside the superior, it is going to enter inside the right atrium. Okay, you can see here. So this is the umbilical vein and this is the inferior vena cava. Umbilical vein carries oxygenated blood, inferior vena cava carries deoxygenated blood. So in the ductus venosus, mixing of the blood is going to take place, and the mixed blood through the inferior vena cava, it enters inside the right atrium. Where it is entering? It is entering inside the right atrium. As I mentioned already, it is a mixed blood. Oxygen blood is also there, deoxygenated blood is also there. So in the right atrium, in the junction, underline the word junction of inferior vena cava and the right atrium, there is a part called as Eustachian wall. In the junction of the inferior vena cava and the right atrium, there is a wall called as Eustachian wall. Eustachian wall, the function of the Eustachian wall is to separate the oxygenated blood and deoxygenated blood. Understand? Yes. Oxygenated blood and deoxygenated blood is separated by the Eustachian wall, and the Eustachian wall is the one which is present in the junction of inferior vena cava and the right atrium. Okay, fine. So now the mixed blood, it is going to get separated by the Eustachian wall, and the oxygenated blood from the right atrium. Look into the image. From the right atrium, because of the Eustachian wall, the oxygenated blood from the right atrium is going to enter inside the left atrium through foramen oval. What is foramen oval? Opening between the two atriums, right and left. In between that, there is an opening that is called as what? Foramen oval. Okay. So the oxygenated blood from the right atrium, it is going to shunt into the left atrium by Eustachian wall. At the same time, deoxygenated blood from the right atrium is going to enter inside the right ventricle. It is also done by the Eustachian wall. So the separation of the oxygenated blood from the right atrium to the left atrium. Once again, I will repeat. The separation of the oxygenated blood and deoxygenated blood is done by the Eustachian wall, and the Eustachian wall is the one which is shifting the oxygenated blood from the right atrium. See here, oxygenated blood from the right atrium to the left atrium, and deoxygenated blood from the right atrium to the right ventricle. These two works are done by the Eustachian wall. So now you are very clear that the right atrium is shunted the blood to the left atrium. Which blood? Oxygenated blood. The right atrium is shunted the blood to the right ventricle. Which blood? Deoxygenated blood. These two work is done by the Eustachian wall. It is present in the junction of inferior vena cava and the right atrium. Clear, guys? Yes? Fine. So foramen oval means opening between the right atrium and left atrium. Okay. And Eustachian tube, it is present in the junction of inferior vena cava and the right atrium. Ductus venosus means opening between the inferior vena cava and the umbilical vein. Okay, so these are all the key points you're supposed to remember. And one more additional key point, this question asked so many times in the exam, ascending aorta carries oxygenated blood and descending aorta carries less oxygenated blood, or means, less oxygenated blood. Why it is happening? High concentration of oxygen is carried by the ascending aorta and less amount of oxygen is carried by the descending aorta. Why it is happening? You can see after, listen carefully with this image, from the right atrium, the blood is shunted to the left atrium. Which blood? Oxygenated blood. The oxygenated blood from the left atrium now enter inside the left ventricles. From the left ventricle, the oxygenated blood will go inside the what? Aorta, right? So highly concentrated oxygenated blood from the left ventricle, it is entering inside the ascending aorta, and it is supplying the brain and upper body. Brain and upper body. You can see very clearly here, the left ventricle pumped the blood through the aorta, that is ascending aorta, and the blood is highly concentrated, highly oxygen concentrated blood is reaching the head and the upper body, that is heart, arms, everything is coming under the upper body. Okay, so ascending aorta always carrying the oxygenated, highly concentrated oxygenated blood. Okay, and one more thing is there, that is descending aorta. You can see here, this channel is over. That is from the right atrium, understand carefully, from the right atrium, the oxygenated blood entering inside the left atrium, from the left atrium, the oxygenated blood entering inside the left ventricle, from the left ventricle, the oxygenated blood is going to the ascending aorta. This is one channel, okay? So concentrated blood, highly concentrated blood is going to the head and upper body. One more thing I already have explained that from the right atrium, the blood, deoxygenated blood is entering inside the what? Right ventricle because of eustachian wall, right? Previously, I have explained that from the right atrium, the deoxygenated blood is entering inside the right ventricle. This deoxygenated blood through the pulmonary artery, underline the word, through the pulmonary artery, through the ductus arteriosum. Through the ductus arteriosus, it is entering inside the aorta. Once again, I will repeat. From the right atrium, the deoxygenated blood is entering inside the right ventricle. From the right ventricle, the deoxygenated blood is entering inside the pulmonary artery. In the pulmonary artery, there is a part called as what? Ductus arteriosus. So, ductus arteriosus is nothing but opening between the pulmonary artery and the aorta. Pulmonary artery and the aorta. So, from the pulmonary artery, the deoxygenated blood is entering inside the descending aorta. That's why descending aorta carries mixed blood, whereas ascending aorta carries high concentrated of oxygen blood. Okay, so lower part of the body will be receiving the mixed type of blood, whereas the upper body and the head, it will receive the highly oxygenated blood for the fetus. Okay, so now I hope everyone understand about what is eustachian wall, what is ductus venosus, what is foramen oval, what is ductus arteriosus. These four things are very important in the fetal circulation. If you understand this one, why the ascending aorta carries highly concentrated blood, why the descending aorta carries mixed blood or low concentrated blood, then solving the question related to fetal circulation is very, very, very easy, guys. Okay, so you can see here. Fine. So far we discussed about what? Fetal circulation. So now the baby delivered. Baby got delivered. Okay. Baby has taken the first breath. After taking the first breath, immediately the lungs will start to work. If the lung starts to work, what will happen to the foramen oval? Foramen oval is nothing but the opening between two atrium. And what will happen to the ductus arteriosus? It is nothing but the opening between the pulmonary artery and the aorta. And what will happen to the ductus venosus? It is the opening between the umbilical vein and inferior vena cava. What will happen to these three structures? The foramen oval will automatically close after taking the first breath. So that time it is called as what? Fossa ovalis. Once the foramen oval is closed, after taking the first breath, it is called as what? Fossa ovalis. Very, very important points, guys. Okay, repeatedly from here, you know, questions are already asked in the exam. Foramen oval is transformed to fossa ovalis after the first breath. And ductus arteriosus, it is closed and it is transformed to ligamentum arteriosum. Ligamentum arteriosum after the first breath. And ductus venosus, it is also closed and it will become ligamentum venosum. Venosus will become ligamentum venosum. Arteriosus will become ligamentum arteriosum. And foramen oval will become fossa ovalis. So these things you have to remember. These are all the key points, very, very essential for your upcoming examinations. Okay, with this base, with this concept, let's solve some questions. Okay, because this is the basics of fetal circulation. If you understand that, we can solve the important questions. Okay, let's see. Let's start with the eustachian valve question, because in the introduction I have explained very clearly about the eustachian valve. It is the one which is used to separate the oxygenated and deoxygenated blood, which is present in the junction of the inferior vena cava and the right atrium, right? So let's see the question. Which of the following best describe the function of the eustachian valve in the fetal circulation? Here always you have to check for the key point. Function of the eustachian valve in fetal circulation is the key point here. Okay, let's see what are all the options they have given here. They have asked about the function. It directs the oxygen-rich blood from the inferior vena cava toward the foramen oval. Obviously, yes, that is the right answer, because eustachian valve is the one which pushes the oxygenated blood from the right atrium into the left atrium. Okay, fine. So the next option is it prevents the backflow of the blood from the left atrium. No, it's not right. It regulates the blood flow between the right and left ventricle. No, there is it is not playing any role in the ventricles. It connects the pulmonary artery and aorta, that is ductus arteriosus. Okay, so here for this question, if they're asking the function of eustachian tube, means the right answer is going to be option A, that is it directs the oxygen-rich blood from the inferior vena cava towards the foramen oval. Towards the foramen oval. So, which is the right answer here? Option A is going to be the right answer. Already I have given the rationale for this one. The same thing is repeating here again and again. Okay, just go through it. Once again, I will read it. The eustachian valve is located in the junction of right atrium and inferior vena cava. Okay, so it is the one which is used to pump the oxygen-rich blood to the left atrium. Okay, through foramen oval. Okay, that's it. So understand the concept, guys. Concepts are very important. Okay, let's move on to the second question. Why does the ascending aorta in the fetal circulation have higher oxygen saturation compared to descending aorta? This question also, this explanation also I have given very clearly. Okay, fine. So the key point here is ascending aorta carries highly concentrated oxygen when compared to descending aorta. Why? So this is the question. Okay, fine. So you can see here the right answer is going to be option B, that is oxygen rich blood from the placenta. It is entering inside the right atrium, but in the right atrium, eustachian tube is the one which is separating the oxygenated blood and deoxygenated blood. Oxygenated blood is pumped to the left atrium, and that oxygenated blood which is present in the left atrium is going to enter inside the left ventricle. From the left ventricle, the oxygenated blood is going to enter inside the ascending aorta. That's why ascending aorta carries high concentrated blood of oxygen. High oxygen concentrated blood. It is because oxygenated blood is circulating. Okay, guys, fine. So the blood from the right atrium, oxygenated blood from the right atrium entering inside the left ventricle. From the right atrium, the oxygenated blood is entering inside the left atrium. From the left atrium, the oxygenated blood is entering inside the left ventricle. From the left ventricle, the oxygenated blood is going inside the aorta, that is ascending aorta. That's why high concentration of the blood is present in the ascending aorta. That's why we selected what? Option B. Clear, guys? So the explanation is given here very clearly. Pause the video and read the explanation if you have any doubts. Okay, fine. The next question is, which fetal vessel carries blood with highest oxygen content? Which fetal vessel carries blood with highest oxygen content? Fetal vessel, you know, two vessels are there, artery and vein. Two arteries and one vein is there. Vein carries oxygenated blood and arteries carry deoxygenated blood. Here they are asking about the high concentrated content is carried by which vessel? Obviously, the right answer is going to be what? Umbilical vein. Option A is going to be the correct answer because umbilical vein carries the highly concentrated oxygen-rich blood. The next one is, what is the fate of the ductus venosus after birth? After the birth, what will happen to the ductus venosus? Okay, so 4 options they have given here. It become ligamental teres. Ligamental teres means it is related to umbilical cord. Okay, we'll discuss that. It become ligamentum venosum. Yes, ductus venosus, it will become what? Ligamentum venosum. Ductus arteriosus, it will become what? Ligamentum arteriosum. Okay, and umbilical arteries, it will become what? Medial umbilical ligament. Umbilical vein, it will become what? Ligamentum teres. Once again, I will repeat. In this question, for this question, the right answer is going to be option B because ductus venosus after birth, it is going to be transformed as what? Ligamentum venosum. Option B is the right one. Option B is the right one for this question. And additional golden points are ligamentum teres is nothing but transformed umbilical vein. After the delivery of the baby, the umbilical vein is transformed to ligamentum teres. Umbilical artery is transformed to umbilical ligament, that is medial umbilical ligament, and ductus arteriosus is transformed to ligamentum arteriosum. Okay, the clear explanation I have given here. Okay, again pause the video and just go through it. Okay, fine. So the next question is, in the event of persistent pulmonary hypertension of newborn, in short, PPHN, which fetal circulatory structure remain functionally open? There are so many structures which is there in the fetus, that is ductus arteriosus, ductus venosus, foramen ovale, right? So among these three, which one will always remain open if the baby or if the newborn is having PPHN, that is persistent pulmonary hypertension of the newborn? So this is the question. Okay, fine. Let's see the option: ductus venosus, foramen ovale, umbilical vein, ligamentum arteriosum. Among these four, which one will remain open if the baby or newborn has PPH1, persistent pulmonary hypertension of newborn? So here the right answer is going to be option B, that is foramen ovale. That is the opening between two atrium. This one will remain open if the baby is suffering from PPHN, persistent pulmonary hypertension of newborn. Okay, fine. So again, because of increase in the pulmonary artery, because of increase in the pressure of the pulmonary artery, okay, the baby cannot withstand the pressure. So still the foramen ovale is always remain open. So that is the explanation I have given here also. You can see here, elevated pulmonary vascular resistance. That is pulmonary vascular resistance in the sense pulmonary artery pressure is increased after the first breath. Okay, fine. So it leads to what? The baby is not adapting to the first breath. The baby is not adjusting to the first breath. Okay, so the pulmonary artery pressure is increasing. So because of that increasing in the pressure, the foramen ovale is not at all closing. It is not at all closing. Still the foramen ovale is open and the right to left shunt is still present. So that is the problem which is happening in the PPHN. Okay, so this question is already asked in the exams, guys. Okay, hope everyone would have understand what is fetal circulation, what are all the important point, what is ductus venosus, arteriosus, foramen ovale. So if you know these structures in detail very clearly, it is very easy for you to solve the question which is related to fetal circulation. And if you have any doubt anywhere, you can drop your message in the chat box, guys. And all the best for your upcoming examination.